Let's go back to the phones now at 541-686-0590. It's Doc Talk with Dr. John. Hi, who's this? What's your name?
Hi, it's Cathryn Chicola.
Hi, Kathy.
Hi, Kathy.
Oh,
Hey,
this
John.
is Dr. Kathy.
Dr. Kathy.
How you doing, Doctor?
I'm good.
Good. Glad you called in this morning. Back in November of last year, the U.S. Preventative Services Task Force recommended changing the current mammography screening guidelines for average-risk women. We're going to talk about that. Now, they recommend beginning biennial screening at age 50 instead of annual mammograms starting at the age of 40. And, Doctor, how often do you think women actually should get a mammogram?
Well, I was pretty disappointed by these recommendations because at the beginning of my career, I remember when it was very disorganized and there wasn't any push to do mammography or really breast self-exam or any of the things that we've grown accustomed to over the last few years. And at that time, the breast cancer death rate had stayed exactly the same for about 50 years. And then in the early 90s, we started screening yearly, and the death rate from breast cancer has dropped by 30% since that time. So I do think mammography has made a difference in not only in breast cancer diagnosis, but in how women do. So I still am joined by the American College of Radiology and Susan Komen and the American Cancer Society, and I still recommend that women starting at age 40 get screened for breast cancer.
What was the reasoning behind that change of that they did last November? What was the reasoning behind that? Because I've read so much other people say, professionals, experts in the field say that was wrong for them to make that change.
Well, the U.S. Preventive Services Task Force panel is a panel that's made up of statisticians, scientists, and physicians who basically look at different medical devices and medical procedures and determine validity. And the thing that bothered me about this task force is that they ignored some of the very compelling studies that have been done not only here in the United States, but particularly in Sweden, where they've been watching these statistics for a lot longer than we have. And interestingly, on that task force, there wasn't a breast surgeon, there wasn't a radiologist, there were no really clinicians who actually take care of patients on the panel. So I was very disappointed that they came up with these recommendations, because I think that what it's going to do is we're going to see patients at a later stage. Obviously, if they're waiting 2 years between mammograms, if we pick up a new cancer, it probably will be bigger and harder to treat because of this delay.
So if a woman's not considered to be, high risk, should she still get a mammogram every year? Or is that a waste?
Well, the thing is that it's hard to determine if you're high risk or not. About 75% of our patients in my practice at Oregon Imaging Center don't have a family history or any lifestyle things that cause them to be high risk. So certainly women who are high risk should definitely be getting them at age 40 or even sooner, depending on how high their risk is. But the problem is determining if you're high risk or not. So I still think that it's prudent for women at age 40 to continue to get mammograms.
Kathy, this is Dr. John, and just so that our listeners know, it is fantastic that you were able to call in. Kathy is the director of women's imaging at Oregon Imaging Center, and our community, I think, is so fortunate to have someone with your skill in our community, because I'm guessing you've probably read a couple 100,000 mammograms.
Easily. I did 12,000 just last year alone.
Holy cow.
But,
wow.
One thing I wanted to point out, though, is just last year, just 2009, in Lane County, just at Oregon Imaging Centers, we had 220 cancers discovered. And of that 220 women, 34 of them were under the age of 50, and 8 of them were under the age of 40. So it's not a real stretch of the imagination to see that we're finding cancers in people who are younger than 50. So, I just think that this was a step in the wrong direction. I think mammography has been one of the most successful public health initiatives that we've had, certainly in my career.
So for the high-risk group, obviously genetics plays a role, family history. What's some other factors that come into play?
Well, family history probably is about the strongest, especially mother, sister, daughter, that primary relative or multiple relatives that have had breast cancer. But other things that play into it are women who have never had children before, people who have estrogen exposure for a long time, women who start their periods very early and have late menopause, smoking, diet, high-fat diets have been shown to be associated with different types of cancer, and breast cancer is one of those.
And I'm sorry, go ahead.
But also, smoking is another thing that has a role.
So there's plenty of evidence to support that annual mammograms do save lives.
I think there's certainly in the radiology literature and also in the surgical literature, there are definitely, major studies and analyses of multiple studies that have definitely shown a benefit to mammography. And the numbers basically don't really lie. The death rate from breast cancer since the 1990s has decreased by 30%. And we're definitely diagnosing cancers a lot earlier so that women can have much breast salvage surgery, the lumpectomy versus mastectomy. When I first started my career, pretty much everyone who got discovered with breast cancer, and we were discovering them much later, got a mastectomy, and the radiation and chemotherapy that followed was not nearly as focused as it is today. So I've really seen sort of a revolution in breast cancer diagnosis and treatment just in my career, and I'd hate to see that reversed.
Kathy, I get a lot of patients that come in the office and they say, do I really have to get that mammogram? I just hate getting that. And, I try to tell them mammograms aren't perfect, but it's the best screening tool that we have.
That is true. Mammography will detect 90 to 92% of all breast cancers. So you still have the 8 to 10% that we just can't see, and that's why we will use ultrasound with that. But the bottom line is that it's relatively inexpensive compared to other medical procedures. It's available, and it's a proven tool. So I think that its validity has been proven over and over again, and I hate to see it being diminished by these recommendations.
Dr. Cathryn Chicola, Director of Women's Imaging, Oregon Imaging Centers. Thanks for being guest here on Doc Talk on KUGN.
Hey, thank y'all.
Thanks, Kathy.
Have a great day.